I don't want to take another tumble. I've already done the backflip in the power chair off the lift to the concrete. Don't recommend it. It's bad enough to have TM and then fracture your cervical spine on top of it. So I'm good. It's not on a hill. Just to kind of build on what Dr. Wagner said, advocacy is kind of where I started. After having TM, I kind of ended up hanging out with the therapist all the time, trying to, get to the next level, and then sitting in on in-services and such, and kind of giving the user's perspective. And then they kept saying, you ought to go to med school and that. And I'm like, look, I don't do sick people, I'm allergic to everything. I don't do that. But thought that occupational therapy was kind of the fit. And I kind of have a niche where most of what I do is educating and employing people with disabilities, ADA, public access, and assistive technology. So I kind of think that all of us are natural OTs if we have any of these disorders, because we have to be problem solvers and have to kind of represent ourselves and figure it out, because unless you're fortunate enough to live in Baltimore around some of these great physicians and stuff that are part of our team, if you live in South Carolina and other rural areas, you better know what you're doing, because you could really get screwed up. Worse, I guess. But anyway, there's a clicker here somewhere. Sandy, can you reach it? All the information, the handouts is on, I think Jim's already loaded to the TM site, or it will be. There are a list of resources with links. You can either put in the address or just click on the link for some resources that will help you out. But advocacy, like I said, is my thing, because I feel like the way I have survived and gone on to do the things that I want to do is through my own advocacy efforts, not only for myself, but for everybody else. And most of the time, I don't get paid for half of what I do as far as financial reimbursement, but you get paid in other ways, and that's some of the things I'm going to talk about as well. Advocacy is just basically a set of technical skills that you develop. It's about getting your voice out there. And what I feel is that successful advocacy is when people are empowered with dignity and confidence to act, and the world of possibilities opens up. Okay, unleash an advocate in each of us. And today what I'm going to talk about in this session is self-advocacy and employment. And one of the first things that you have to do is kind of do a self-assessment and ask critical questions of yourself and get a situation. I apologize for the small print, but I wanted to kind of get the handouts out there so you kind of see as an outline. But when doing a self-assessment, one of the first things you have to do is your health. If you don't have your health, you don't have anything. And that goes for care providers as well. You got to, like we've already heard, you've got to take care of yourself, because if you're not healthy, one, you're not going to work. You don't stay healthy, you're not going to stay gainfully employed. And it just starts this whole cycle. I know Alan talked about he went to work too soon, and then had to kind of backpedal and start again. And I know many of us have experienced these situations and trying to figure it out. And that's not always you went to work too soon. I just call that another learning experience in the journey of transverse myelitis and these other rare disorders. But one thing you have to do is you have to know what your current situation is. Your health, what your health expenses are, what your needs are, look at your basic needs and what they cost. And with these things, you actually make a list and write them down, and any of them that have a financial component to it, write that figure down. And I'll go into that a little bit. But, your basic needs, your education and training, do you have it? Do you need it? Work experience, do you have any? Do you need to get some? Your goals, the availability of work in your area, and the availability of you to be able to work. And a lot of that depends on your financial means, transportation, your health, your family supports, etc. Transportation is a big issue, especially if you live in areas like I do where public transportation, they go, huh? That's hitchhiking. The other thing is moving through what are your current supports and the cost, what are your needed supports and costs, What current benefits do you have? Are you on SSI? Have you filed it or not? Social Security, Medicaid, Medicare, your health insurance, and your other current income and resources. All this is important because you kind of have to have a base to start with to see what route you want to go when you're looking at employment. As you just heard in the last session, your health advocacy, I can't go there. Like I said before, if you're not healthy, you can't stay healthy, you're not going to work. And nobody's going to want you to work. If you look sick, you act sick, who's going to hire you? It's hard enough to go in a wheelchair, or if you're kind of limping in or something, they're thinking, oh, my God, what are we going to do here? What's this going to cost us, But let your needs be known with your doctors. When talking about work, find out, what do they recommend? Do they think this is the right time? Not just your doctors, but usually your therapist, your OT, your PT, your care providers, your whole team can provide you some valuable input with looking at, what are some strategies when looking at that. Communicate with your insurance companies. Sometimes they'll say, oh, we don't pay for that kind of equipment. But if you need a certain specialized piece of equipment that will enable you to work, if you tell your insurance company, look, you help me go to work, you're not going to be my insurance company anymore. I'm going to get new insurance. Who knows? But in case management, if you can medically justify the equipment that you need, most of the time you have to still use the in-the-home language, but also to get to health care services and to be able to provide supports to pay for, to provide better health and well-being. There's ways to document it. And communicating with those insurance companies to help them understand your needs is critical. You got to ask questions. You're here. That's a big start. I mean, like I said, everybody here, we're talking to the choir because you've made big efforts to be here, which is fabulous. Advocating for yourself in TM. I know, with just this injury, it's kind of like, I think the doctor read one article that said, sometimes when you have trauma, you have a recurrence of symptoms. Therefore, we're not going to even look at you. 3 hours later, you get a CT, you still can't move your arms. We're going to send you home. Makes sense to me, right? Somebody's got a cervical injury and has been unconscious. But that's the treatment I got. So it's like, I got to get back to work with this ER and letting them know not only about TM, but, just because they say you're a quad doesn't mean you can't move anything, and getting that misconception. So having to advocate for yourself. I take copies of the TMA journal and leave it with the ER directors. I go on all the websites and see if there's new neurologists in the area, and if they have a contact us, I send it to them. Whether they want it or not, they get it. Give it to your physicians, ask them to give it to other people. I give it to people who ask me really stupid questions. I've given it to my employers so that they understand better why I'm asking for certain accommodations or longer days with a bigger break in between or coming in late or whatever. So it's an excellent resource to help you get where you need to be for your employment goals. Promoting grassroots research. With this current administration, we don't need to go there, but trying to promote stem cell research and that and helping your representatives know, you can go online and make that email, and it's real fast. The support groups, fundraising projects, I know the Accelerated Cure Project, TMA, Project Restore. Everybody needs money, so if there's anything that you can do to help promote things, that's a great way to benefit and put things out there, because the more that's out there and the more that these organizations can do, the more you benefit from them. Education and training. And why I started this with primary education is because we have a lot of parents here with kids with disabilities, and a lot of kids with TM and some of the other rare disorders don't have as significant obvious disabilities or don't fall under special education because they don't have learning disabilities per se. Some of them do. So they're not going to fall under IDEA, which is the Individual Education Act, but they would fall under a 504 plan, which is a Rehabilitation Act, which ensures that your child is going to get the reasonable accommodations they need to get an effective education. And they have to do it. in the public schools and in private schools who receive any kind of tax credit. So if they get a state or federal tax credit, they fall under the same rules. Post-secondary education. There's a 504 or a ADA officer in every institution that receives state and federal funding. That means anybody that has scholarships, anybody that gets grants, falls under this. I've only found one institution, and that's Bob Jones University in South Carolina, who accepts no tax credits, so they can discriminate against whoever they want. But under that, you get reasonable accommodations. One of the problems is trying to find who that ADA officer or disability office is sometimes a trick, because sometimes it's somebody is assigned that on paper and they don't even know that they're that person. So, but every institution should have a process to go through so that you get the training and services you need. VR is not a one-shot deal. They help with transition in the schools as early as age 14. Most of them do it between 16 and 21 for kids in primary education. They do pre-employment training while they're in school, and that goes for people and adults in the community as well. They also do employment and help with getting the reasonable accommodations that you can do. They do post-employment, so if you're going to be able to stay employed, something comes up, your disability changes, you've got a van that has a lift that's 10 years old, you know, and you've got to get something else in order to stay at work. They can do post-employment services, and they can do re-employment. I just found this out because I thought it was like, okay, they help pay for me to go to OT school and all that. I changed careers, in a sense, in redirection, because I was working for the Social Security Administration doing disability policy and working as an advisor to the commissioner on return to work issues, and then wanted to go back to doing the continuing ed and access and ADA and service dog training and things like that. And we also herd sheep with our dogs, so I've got them paying for all kinds of stuff. But they approached me and said, well, let us help you. And I thought, well, they already paid for me to go to OT school. Why would they help me again? But circumstances change, and as disability progresses or you just career changes progress, they will help you. You have school vocational places. You have employment networks through the Social Security Administration's Ticket to Work. There's specialized training, continuing education, certifications, licensure renewal. Those are all things that still you can get reasonable accommodations. They still have to accommodate your needs and requirements under the ADA. Transition into work, we talked about a little bit before, starting at age 4, as early as age 14 if you request it. Mandatory for VR that to start services at 16. You have the transition to work, which is a part of all schools for all kids, disabled or not. You also have, there's a big problem in schools. The primary education is great with least restrictive environments. The kids grow up thinking and active in disabled sports programs and regular ed with their non-disabled peers. And then they get to college and the real world hits where there's not all these supports and saying, hey, you can do whatever it is that you want to do. And they realize, oh my God, the world's not really that accessible. And that's where self-advocacy and training at a young age and encouraging that for the health professionals to stay involved with that and getting these experiences, because there's a major gap. And we're seeing a lot of kids that are going off to college all excited just like their other peers, and then they're not successful. Because now that's the first time they've had to provide their own care. They've had to do all these schedules. They had to be somewhere and be responsible for themselves and deal with all the social issues of bowel and bladder management and things like that in an unsecure environment. And so that's a major gap that I really encourage healthcare professionals to get involved and look at. Looking at post-illness to work. If you're going back to a previous job, that's where people have the most success, if it's a job they liked and it's people they liked, and if you were a good employee to start with. Going back to previous jobs, sometimes because of your disability isn't no longer available because you can't meet the essential functions and technical standards of that position with or without accommodations. So you have to rethink strategies and what training needs to be done, or are there other options with your previous employer. And most of the time there are. Going to a new job, I looked at it as, well, I was originally going to be a pilot. Somehow the FAA kind of frowns on people with extensor spasms flying, you know. I was like, whoa, we're going fast. And now we can't stop. But, you know, so that was an issue. So I had to change gears, and the evolution of my career changes came because of my disability, and I looked at it as an opportunity to make different changes. I think in the face of adversity or change, you know, people make decisions and move along, and I think it can be a positive move because there are opportunities, you know, whereas before I either had academic scholarships or loans, and which, by the way, if you became disabled after you had guaranteed student loans, you can get those loans excused because you're disabled. So wait a month and then go to school. There are advantages. If you want to change careers, there are opportunities, there's funding sources that are out there. And there's also programs like, I've met quite a few people in agriculture, and the Department of Agriculture has a program called Agribility. And if you are working in agriculture and need services, there are 23 states a part of the project currently, and new states could apply this year. So I'd encourage you to talk to your legislators if your state is not one of them. But for example, a gentleman got transverse myelitis in Georgia. They came in and put sidewalks on his farm. They paved his driveway. They put lifts on the tractor. He has hand controls. He has power lifts. And he fully functions and actually is more productive now than he was before his disability. So there are things out there. Things to think about. Have you filed for Social Security and SSI or not? I always encourage people to do it. One reason is it gives you a protective filing date. Even if it's early and you've just been diagnosed, it gives you what they call protective filing so that under Social Security rules, you either have a condition that's going to result in death or last at least a year to where you cannot work at what they call substantial gainful activity, which is, what is SGA right now? I forget. I haven't been there long. Oh, it's $940 a month for people with disabilities, and if you're considered legally blind, it's $1,570. The difference in that is the Commission for the Blind and the people who are blind have been really good advocates and separated themselves from the rest of us. And so they go, hey, Congress, close your eyes. How could you do your job? And the Commission for the Blind is the voc rehab for people who are blind, and they pay for only entry-level services just like voc rehab except law school. So the Commission will pay for law school, whereas voc rehab tends not to. So they've done a better job at advocacy, but that's the difference in the amounts. If you file for a disability and you're approved, you get 9 trial work months plus an additional 3 months where you can work and make as much as you want to make plus get your benefit. To me, I'm like, whoo, money for being disabled, you know. And then you get what's the benefits of the return to work programs where you have an expedited reinstatement, which means an easy back on. So if for some reason, because of your disability, you can't work, nothing else has changed, you can get right back on. Your benefits will start at the same dollar amount as when you left, and then they'll make the final decision. A lot of people with transverse myelitis and MS and the rare neuromuscular disorders get denied initially. And part of that is because these physicians, especially not these guys necessarily, but the ones that we mostly are dealing with, don't document our conditions because they make the decision based on the medical evidence that's presented. And they put unknown or idiopathic or, you know, maybe not permanent or not static or a current exacerbation, and don't put to last more than a year. And the other thing is we don't put down all of our conditions because they look at the whole thing in totality, not just one diagnosis. So if you have transverse myelitis and are ambulatory, but you also have depression, and you also have neuropathic pain, and you also have lupus, and you also have skin cancer or whatever, they're going to look at that in the totality. And they look at what your age is, what your past employment in the last 15 years is, what your disabling conditions are, and your functional capacity, considering all that, to work is. If you're 55 and older and have a high school education and done mostly manual work, you can almost have a hangnail and get approved. And that's what people look at. Well, why did they get approved? Or this person has a brain tumor and they were denied. Well, part of that is, thank goodness, people with brain tumors live. And they live more than a year. And they go back to work sooner than a year. So it's a complicated process. But the older you are, or the younger you are, can be easier to get on. The less education you have and the less work experience you have, the easier it is to get on because you don't have transferable skills. And so it kind of gets complicated. And when people say, well, they denied me, but they didn't deny there, but I'm more disabled, you have to get more information in order to help people. IRWEs are employment-related work expenses, the cost of your out-of-pocket cost of your medications, your service dog's vet bills, food bills, equipment, training costs, going to the training, your gas in an adapted vehicle to and from work. If you're blind, your taxes and your work, your lunch at work. They have a little extra stuff. But are all things that come off the top of determining whether it's SGA. So if your out-of-pocket medical expenses, because at one time I was paying over $1,400 a month out of pocket. I was working for the Social Security Administration as a GS-12, making almost $70,000 a year, but could be eligible for Medicaid because of all the employment-related work expenses, and by the time you take that off the top. The other thing you have is subsidy. You've worked for a place and they're helping you out. I know I've been there where I wasn't fully earning my wages, but I still got my same check, but they worked with me until I got better. That would be considered subsidy. It's like pat on the back to the people. Your employers get nervous about it, but it's subsidy and it doesn't impact it comes off the top because you're not fully earning that wage. And the only thing that counts is wages or your net profit if you're self-employed. A PASS is a plan to achieve self-support. There's a way to set aside your salary in order to get equipment and things that you need to work. It's much better. The Ticket to Work has new guidelines have just come out, and they're really going towards employers being employment networks. I call it the travel agency theory. If the employer is the employer network and they're working on your vocational training and your accommodations and you go to work for them, they get a kickback. So it's just like a travel agent. If they make your travel plans, they get 10% of that ticket. So it's a big selling point to employers because how many people can they hire and get money back? And then anything that they do, there's all kinds of tax credits and stuff for employers who employ people with disabilities and anything that they do for accommodations. The other thing to consider is your insurance. If you have Medicaid and our Medicaid waiver programs, are they paying for attendant care services and equipment? Is Medicare your only insurance or providing things? There is an extended Medicare coverage when you return to work of Part A up to 8 years. Your private insurance, if you've got it, you got to consider pre-existing conditions when you change jobs. You can't have a lapse in coverage. If your condition is covered for 2 years continuous and you move on to another job that doesn't have pre-existing conditions, fine, go do your thing. If you move to a job and there's going to be a break in coverage, now you have a pre-existing condition. So you're going to want to pay the outrageous COBRA fee to keep, even if it means getting a loan to do it. And there are state loan programs that it's not a VR program, but most of the state VR organizations are the ones overseeing it. And you can actually apply for a very low interest loan that the state will kind of subsidize, and they'll put up the collateral. So if you default, the state deals with you and the banks don't have to worry about it. But to help pay those COBRA fees so you don't have an interruption in services. Looking at whether or not to work. And the reason I said to make that list before is you got to know what services and resources and stuff you're getting. If you're getting SSI, you're on a Medicaid waiver program with 40 hours a week attendant care. They're paying for your catheters and medication copays. They're paying for transportation. They're paying for things that Medicaid typically doesn't pay for. You're looking at a value of close to $70,000 a year. That means if you're going to go work at a job and get paid, you need to have take-home pay of $70,000 a year in insurance that will cover these services. Otherwise, you've got to pay for it yourself. So that's something when somebody says, I want to go back to work, I need more money, you have to really look at, will that job result in actually more income to your home? So you look at the difference of maintaining previous work, part-time, full-time, and stipends. The thing with stipends is like if I do a contract, a lot of my stipends would be for $500. I'm just saying, the IRS, the only time you have to report a stipend is over $500. That's all I'm going to say. I'm not telling you you don't have to report it, but nobody else is. Looking at unpaid barter systems, doing presentations for the chance to go have the opportunity to present, your expenses are covered, you might be able to pick up equipment, working with different vendors, you might get a nice vacation out of it. There's ways of trading services like the old way. Some of the guys who are electricians will still go in and do electrical work in place of getting other things in order to keep the benefits and stuff that they do. Volunteer work. A lot of people say, you know, I can't afford to lose the benefits and stuff that I do, and they work as volunteers. And it all comes down to quality of life and having what you need. So going to work, you can be working and out there and getting paid in ways that aren't necessarily like paid tax income, but still have that same quality of life. And that's all things that you have to consider in the scheme of things. Then once you do decide to go to work, choosing whether or not to disclose or not disclose your disability and when you need to do it. If you need reasonable accommodations, you have to disclose your disability and make that request. If you don't make a request for a reasonable accommodation, then no employer is obligated to provide it. If you're not successful in work or you lose your job because you're not able to perform a job, and you could have done it if you had an accommodation, you can't come back after the fact and say, but I was disabled, and you didn't do. Unless you ask, they have no obligation. So it's real important. Some people choose to disclose after they've secured the position because they have the education and experience and they've deemed, you know, they've been hired, and then they disclose. Some of us, if we walk in, well, you know, not much I can say. What do you need? Wheelchair access? You know, maybe some technology concerns. Depends on where I am with my TM. Do I need voice recognition software? Do I need to do like Jim does with the Morse code? Do I need things that can go up and down? Some people with TM, you know, and the other disorders, they can't sit that long, so they need adjustable height workstations. I mean, the technology and stuff that's out there is great. But one of the easiest accommodations is job sharing, and it doesn't cost anything. Most accommodations still in the workforce, even today with the skyrocketing cost of things, are less than $500. And everything that the employer pays is a tax credit. Assistive technology is our friend. Service dogs fall under assistive technology under the ADA. They perform physical tasks, so you cannot be denied access for your service dog unless you're a nurse and you work in a delivery room or in an emergency room, because you still can't go in a sterile environment. But other than that, unless they pose a direct threat, they're covered. Some of the resources that are available to you. The TMA site, Jim Lubin's site, I mean, I was going through cross-referencing all my stuff, and I'm like, well, Jim's already got it. Jim's already got it. Oh, I found one he doesn't have, you know. So I tried to add some stuff that were different. The TM site has links to several others. The handout that's online has a lot. Some of the resources I put on there are places to get assistive technology, places you might be that might fund assistive technology, some that will help fund services to nonprofit organizations. One of the ways a lot of people do go back to work is through their nonprofit or forming nonprofit organizations. They get stipends and or just services and providing things to kind of impact and benefit those who are like themselves. The Medicare therapy caps, which puts a $1,500 cap on PT and speech combined, and OT separate, is in the process of getting repealed. So far, there's been a moratorium, which means if you're on Medicare, you get $1,500 for the year, and that's a rolling year, not a calendar year. So that's not a lot of therapy. Stem cell research, we all know about that and advocating for that. And then the election's coming up. You've got to vote or don't complain. Ways to get involved through all these organizations. And then here's the links on just how to get to your representative, and you can send a letter. If you go to the American Association of People with Disabilities site, they have form letters, and all you have to do is type your name in, and it goes off. So, and that's about it. I do want to thank everyone here for the opportunity, and also TMA and Project Restore for doing all this.